Welcome to Wellness Rebranded.
We know there is so much conflicting health and fitness advice out there.
And you're tired of the wellness fads, endless diets, and impossible standards that make you feel like nothing you do is ever enough.
You're ready to tune into your mind and body and feel empowered around health.
We're the Healing Trio, here to help you redesign your relationships with food, fitness, and yourself.
I'm Elizabeth, registered dietitian and certified intuitive eating counselor.
I'm Maria, licensed mental health therapist.
And I'm Tara, personal trainer.
Together, we're changing the narrative on health away from diet culture, hustle culture, and toxic positivity and towards healthful self-care.
So grab your water bottle, get ready to laugh, learn, and grow.
And let's start rebranding your wellness journey.
Congratulations, ladies of Wellness Rebranded. I really enjoy your podcast. I loved the episode where you asked 9 questions to get to know ourselves better. It was so useful to stop and think about what we want and what really matters for each one of us. I also enjoyed the episode about being a good listener. I try hard to practice that, especially with my kids, but it's rare. It's rare to find people that can do that, and it's so important. I'm just so grateful for all those tips you share, and I want to wish you good luck, and thanks again.
Welcome back to another episode of Wellness Rebranded. I'm Tara, and I'm here with Maria and Elizabeth. And today we are super excited because we have a special guest with us. Gina Hahn is a physical therapist who I send many of my clients to go see. She specializes in pelvic health, and she's really a wonderful coach and a great resource for me. So Gina, thank you so much for being on with us.
Yay!
Hi. Thank you, Tara, Elizabeth, and Maria. It is an honor to be here with you.
Jean, let's kick it off. Why don't you introduce yourself and kind of tell us more about your journey and what you're doing now?
Great. So I am Dr. Gina Hahn. I am actually a Severna Park native, left for a little while, but then came back recently and started my own practice in pelvic health physical therapy. So performance therapy was my passion and my baby, and I had 2 of my own actual human babies, and then decided to make a move to FX physical therapy, where I've been for the last few months. It's been a great move. I love the team there, and I'm helping them to grow their outreach into the community for pelvic health physical therapy in network with insurance, which I'm proud to be a part of that on that side of the coin. And my background, what got me into PT was really athletics. So I bring a lot of sports and strength and conditioning into what I do. And then from being a mother, I really dove very deep into pelvic health. I'm in a bubble of people where it feels like it's very well known, but then I have clients come into my office who are in their 5th and 6th and 7th decade and say, I didn't even know this existed. And that's just a shame. We have much more work to do to get the word out about what pelvic health physical therapy is, which is why I'm here and helping to spread the good word. So thank you guys for having me.
Such an important point. I'll be honest, I never heard about pelvic floor physical therapy until just a few years ago.
Me too.
I didn't know that was a thing. And I mean, I know you don't have to only experience it when you've had babies, but you would think having had babies, I would have been familiar with it, and I wasn't.
No, even if you don't have babies, having a pelvis.
Well, clearly, yeah.
Just for having a pelvis, we should know. But yes, I agree. I didn't know either.
Yes, yeah, it's growing.
The standard of care for postpartum, at least at a bare minimum. It should just be.
Well, in women's health in general.
Go to that.
We're doing the work. There's definitely a big community across the nation. I'm actually going to PelvicCon, which is a pelvic conference for all pelvic health providers in Atlanta, which is very exciting. And we're doing a lot of work to try to get legislation around it, to try to help it become more standardized. Certainly just growing it on social media so that it's more, there's more awareness around it. So we're making some headway, but there's certainly much more work to be done.
So what are the first things for people maybe who don't know a lot about it? What's like the first thing that you would want people to know about pelvic floor therapy or health or wellness?
The first thing, that's a tough question.
Or the
There
first
are,
few things,
Yeah.
yes, I think that Maria hit it on the head, which is it's really not just affecting women who have had babies. It's everybody. I see men. I see people who are just had, in their puberty or in their 20s and they haven't yet had a family. So it can affect a lot of different people. It certainly is related to high stress because similar to our jaw, that's an area where we tend to clench and hold tension. We can do that on our pelvic floor as well. And that can lead to issues with peeing and pooping and pleasure. And nobody's talking about it. Nobody's asking that question. So I have a lot of clients who didn't realize that sex wasn't supposed to be painful, or not even sex. How about pelvic exams in a GYN office? That like that speculum is a painful piece. So just trying to help improve the awareness around like what is normal or what is to be expected. I think that could go a long way. That would probably be the first thing I'd like for more people to know is it's really not just about having a weak pelvic floor, quote unquote, after you've given birth and a baby has passed through your canal. Like that's not the only way that we can address pelvic floor issues or the only reason you would develop pelvic floor issues.
I love that because yes, usually we think that it's out of our control, whatever happens during sex in that case, or during the pelvic exams or exams with your gynecologist. So it's so nice to hear that because me and myself never thought of it.
And then the second point would probably be, I think physical therapy in general is not referred to as much as it should be. So you might go to your gynecologist asking for, hey, like this hurts or this doesn't feel right. And everybody's trying to do their best. Nobody's trying to do harm to clients. But I think people want that quick fix. And so they're often given a medication for, let's say, leaking. There are medications out there that can, they claim to help with incontinence, which is leaking urine. And that's just not the whole story. So some people have to do more work to connect to their pelvic floor. Some people it works fine. But there also should be that referral to somebody like me where I can now do an assessment of what is that person's muscle strength? What is that person's coordination? Do they have even awareness of how to use this part of their body? Because at the end of the day, it's a group of muscles. So we just need to do better about understanding it. There's a long-term gain to this, and it takes effort, and it takes time, and it takes an appropriate diagnosis.
So you mentioned some of them, but what do people look out for? Like how do you know if you might need pelvic floor therapy or just care in general?
Good question. We mentioned some of them, but I'll repeat myself. So if there is pain or discomfort that is to you, if you feel like this doesn't seem normal, that would be a good reason to come ask an expert, is this normal? So pain around your periods, pain with different activities. It could be riding a bike. It could be, as we mentioned, intercourse or playing with a partner. It could be when you're peeing and pooping and there's pain. Another probably very common thing is constipation. There's a lot that you can do over the counter with constipation, but sometimes it's a pelvic floor muscle function issue. And again, those high stress jobs or those people who tend to hold and they can't fully evacuate, that would be a good reason. The very common one of leaking, everybody knows the sneezing, coughing, laughing, peeing situation. That is not normal, although it is common and it's very treatable. Those are the top. And vaginal dryness even. So things where it's maybe every once in a while, it feels like it's related to your cycle. That's something that I can help provide resources for and knowledge and information to give you better health, better wellness.
Hey there, it's Elizabeth. I'm going through my clients' weekly check-in forms and I literally cannot stop smiling to myself. I love seeing when they say that they are eating foods they haven't allowed themselves to eat in years, that they're enjoying it guilt-free, when they tell me how much more in control they feel of their eating, of their food choices, that they're connecting and respecting their hunger and fullness cues, or in the words of one of them, that they're just having so much more fun, feeling normal around food, especially knowing that they have these tools as we head into the holiday season. If you would also like to channel that feel-good eating energy, avoid a regret-fueled January food hangover that sends you rushing for the nearest diet, and rack up easy and simple self-care wins between now and New Year's, I invite you to check out my new email program. It's called Intuitive Eating Through the Holidays, and I will send you a very simple, very fast daily tip via email from Thanksgiving straight through to Christmas to help you eat intuitively, sidestep toxic diet culture, and feel connected to your body, along with some other really cool bonuses and goodies in this program. It's just $67. You can sign up now at the link in the show notes or visit elizabethharrisnutrition.com/feel good holiday eating. And there's a dash in between each of those last words. So elizabethharrisnutrition.com/feel-good-holiday-eating. I really hope to see you there and cannot wait to help you feel fab about food and yourself this holiday season.
Okay, I have like 5 things on that list.
Maria, come see me.
Hi, but hey, I mean,
Maria,
What?
let me introduce you to Gina.
but seriously, hold on one second. I'm sitting here thinking, I'm 46. I have this group of muscles in my body that are so important that I'm sure supporting a bunch of stuff. And nobody talked to me about it. Not even my gynecologist. Nobody talked to me about this. And then you mentioned, yes, just because it's common is not normal. Many times we even normalize what it's
Yes.
common
Yeah.
because
Yes.
if nobody's talking about it, and my friends are, I mean, I'm leaving this episode, I'm calling at least 5 friends. Hold on one second. Are you dry down there? Does it hurt when you go to the gynecologist? Because I have those too. So TMI, but so it's so important to open these conversations because it is our health. It is our well-being. You don't want to be in pain. You don't want to be in discomfort. And if somebody comes out and say, hey, it is possible for these to have a solution outside of medication, geez.
Or even just a solution, period, right?
Right.
Yeah.
I'll tell
Yeah.
you this, when I was postpartum, probably about a year, I went to my gynecologist and I said, hey, like, where'd my libido go? And she was like,
Mhm.
oh, you have kids, like, kiss that shit goodbye for at least 20 years. And I was like, what?
That's
Yeah.
not
And I
okay.
was like, but wait, like, I have a husband also, like, I need a little libido back.
Mhm.
And plus also I liked it. So
I was gonna say it's not just for him, it's for
I
you.
know, I would like for this to come back. And I kid you not, her response was like, oh, if you Google on the internet, there's like some herbs and stuff that would probably help.
Yeah.
And
Mm,
that was like the full response that I got. Like,
mm.
it blew my mind that that's what a medical professional was telling me. And then eventually later, I actually did go to pelvic floor therapy, not with Gina because I didn't know her yet. But it totally helped like all the things.
Yeah. Yeah.
I wonder,
I'm
Jean, do you see that it has to do with also the ideas behind that being like a part that has so many other meanings? Like, I'm coming from a Hispanic culture, right? And the whole thing about sensuality and no, heck no, okay? You're supposed to be, well, I don't know if it's my country, maybe my family and very more smaller group. Is like you have to look conservative and nothing about this pleasure, and you don't go around saying I had the best sex ever today, or we don't talk about these things.
I don't think that's that common here either, though.
Well, we should, okay?
Women,
We should.
our pleasure is completely ignored. Completely. It is not even on the table. I mean, we could talk about how lacking it is in sex ed, but even now, right? It's like women who look a certain way or women who are a certain age are deserving of pleasure, and then everybody else is sort of like left to whatever, right? So 100%. And actually, I have a client who, I'll change her name for this, but let's call her Trisha. She's in her late 20s and she has never had comfort with intercourse. She has a partner, and but she doesn't have pleasure with it. And so she's just kind of performing the act. And when she actually came to me was because she was peeing during jumping rope, and that is what brought her to my office. And then I, of course, asked the question. Maybe I'm the only one asking the question, or maybe I'm the first one to listen and to offer advice. But yes, we went back into her history. She grew up in a very religious household. It was very taboo. Sex was completely off the table. It was something that you save yourself for marriage, and there's no issue with that as a principle, but it should still be taught that once you do engage in it, there should be pleasure, you know? And so a lot of her practice was fine. I tried to connect her to some mental health care providers who can help her through that, because I recognize that as an important pillar, biopsychosocial. This has to do with the psychology of it. So I recognize it, but then I have to refer out, of course. And our training was on like breathing and relaxing through her pelvic floor. And I prescribed like self-touch, like go explore your body. Like that is a part of your homework. So that's the type of stuff that comes into my office. And yes, Maria, you're 100% about where that line of thinking was going.
Because talking about sex is taboo, but even worse if it's pleasurable sex.
Yeah.
So it's taboo. Like, I mean,
Listen, if sex isn't pleasurable, that should be taboo.
Let's flip it on its head. Yes.
and let's rebrand.
Let's rebrand sex. It should be fun for everyone.
Yes.
The effect
totally.
that this can have on your self-esteem. So of course it has an effect on your overall image of yourself and what you think you deserve or you don't when it comes to pleasure. Because I mean, what a source of pleasure that is, masturbation, sex, however you want to call it. But then there's so many ideas behind it that you might start even questioning, how do you even get pleasure? Because I don't know.
There's a big menu. There's a big menu, and there should be of like what it really means to be intimate with somebody. And it's not just one thing, and everybody has differences and everybody has different desires. And, you know, we just need to continue to talk about it and help other people decide and learn what their desires are so that they can then communicate that to themselves as well as to whom their partners are. And let's just also talk about, you know, this is about a wellness, right? So this is lifelong. This might be the partner you have forever, or you might have a sexless marriage and that's why it ends. And then, you know, like that's an issue too. And now you're finding a new partner, right? Like there's so much quality of life wrapped up in pelvic health, a sense of self. There's like a hygiene issue that people have if they're peeing themselves all the time, or, you know, worse, pooping themselves, right? Like this is totally about feeling confident and sexy and all of the things. And yeah, I love what I do. My clients are very motivated, as you might imagine. And I'm just so glad that there's light being shed on what it is that we can do in pelvic health for folks.
Well, if there's one takeaway from this episode for our listeners, I would suggest it be that if you who are listening to this episode are showing any of the things that Gina talked about, the takeaway is that change is possible, that for that to be different and feel different, there is hope that there are things out there that you could get help with for that to be different. And number two, in another episode, Gina, we were talking about a hula hoop event. It's a whole different story, like an event for hula hoop. Now I'm thinking, let's have an event where we just come talk about sex. Like, let's talk about waste. I don't know.
Let's talk about sex, baby.
Let's talk about you and
You and me.
all the
Yes.
good things and the bad things. Yes. Let's talk about the good things and bad things about sex, and let you know that if your sex is not pleasurable, here is Gina to give you tools or ideas of how that can change. Gina, let's do it. And
I
how
love that.
that affect your emotional well-being too, because it is connected. The way we feel physically and the way we think we should perform affects. So there's that. We can even add
I love that.
Yes.
I would be there. I would be there in a heartbeat. And I think that we should also offer some way for people to anonymously be there, because there are folks who they want to keep it private, and that's fine and fair, and like it should be accessible to them too. But I, of course, would be there dressed to the nines and just talking about sex. Like there's no problem.
Yeah, that's so thoughtful of you to include that in. And I was going to say, I love that you sort of talked about quality of life and that this is really wellness, because that's ultimately what it's all about, right? Whether it's like talking about your emotions and your mental health, or keeping your body, moving and physically healthy, or your relationship with food and your body. Like ultimately it all comes down to trying to be as well as you can possibly be and improving your quality of life. All of these things impact how you show up and experience the world. And I just love that you pointed that out.
I just want to say that, like, after I had my son, pelvic floor was a problem for me. Like, I totally did the pee sneeze, and when I wasn't sick or whatever, it was fine. And then I'd get bronchitis or something and be like, holy crap, all I'm doing is peeing my pants all day long. And it totally affected my quality of life, not to mention required mountains of laundry to be washed. So
also quality of life.
Also quality of life. So getting help with that was like absolutely game changer.
Yeah.
And as humans, we're social beings, right? So there's relationships with other people that we've already touched on that are important and could be affected positively or negatively. And that relationship to self, right? Like feeling good in your own body so that then you can show up better.
So one sentence, Gina, how do you want to rebrand the conversation on pelvic floor health?
One sentence. Elizabeth with these like dagger questions.
pressure.
I mean,
Gina, don't listen to her.
mostly, how would you wrap it up? But let's say that.
I would say it's never too late. I have people who are coming to see me in their 70s and have been dealing with some of the symptoms we've been talking about since they had children, or at least since their age 50 when they went through menopause. So it really doesn't matter how old you are, how long the symptoms have been there. There's hope, and you should go ask the hard question and be vulnerable with an expert that you trust.
I love that. See,
I
you
do
nailed
too.
it. I
Nailed
knew you
it.
would.
Girls, as we were sitting here talking, I was like looking at my laptop, and I have a sticker on here that says, if it doesn't bring you income, inspiration, or orgasms, it doesn't belong in your life.
Love it.
Yes.
Oh my gosh, like, talking about sex isn't exactly on brand for me, although I'm not opposed to talking about it. But to have that on there, I was like, wow, that is perfect timing for today.
Funny. Thank you for joining us. This is
Thank you.
How can people find you?
So at Perform X Therapy on Instagram, and also on Facebook with that same handle at Perform X Therapy. That would be a great way to sort of see my content, reach out to me, and just kind of ask questions or like what I post. I love all of it. I love to hear from you. And I'm here as a resource, so don't hesitate to reach out.
So for people who are local, they can also schedule an appointment with you or contact you that way? Perfect. Okay.
Yes.
On our show notes
And just
too.
to clarify, you mean the word perform and the letter X, right?
Correct.
Great. Thank you so
Awesome.
much,
Thanks
Gina.
for coming, Jean.
Thank you, ladies. I really appreciate it. Thank you so much. Have a great day.
Bye.
Thank you for listening. If you want to connect with me outside of this podcast, you can find me on Instagram at coaching_therapist.
I'm Elizabeth. You can find me at Elizabeth Harris Nutrition or in my Facebook group, Health and Healing with Intuitive Eating.
And I'm on Instagram and Facebook at Tara DeLeon Fitness. Guys, if you loved this episode or any of our other episodes, we would love it if you would leave us a review on Apple Podcast. It really, really helps us get the non-diet word out to the rest of the world. So please leave us a review.
Yes, thank you.